Hi there. Now, one of the most common things I see as a chiropractor when people have certainly acute back injuries but also chronic is that they struggle with the squat movement or the squat pattern. In particular, everyday movements like getting up and down out of chairs, getting in and out of their car, getting up out of bed first thing in the morning when they come to stand up. This is quite a common issue, and quite often it's down to a number of things which normally we don't have to think about, but it's actually quite a coordinated motion that involves a lot of muscles and the coordination between the nervous system and the muscular system. And when those things are not quite working as well as they could, and whether that's through injury, arthritis, or just functional problems, then we can struggle with simple movements like going from sitting to standing. I recommend if you do suffer with any of those problems, go and see a specialist like a chiropractor or physio, someone who can assess the way you move, not just get you out of pain, try and figure out why you're getting that problem in the first place. The main reason that can occur is simply because your hips, spine are struggling to stabilise the movement. Pain often causes that. Pain often causes inhibition and a lack of coordination between the systems. So once that has settled back down and you've got a bit more of a relaxed motion, you actually feel like you're a bit more stable around the pelvis and lumbar spine, then I often give this type of exercise to try and help improve motor patterns, so help try and improve the way you move and prevent back injuries from occurring again. Now, I do have a set of basic exercises for people who are struggling with core activation and also for glute activation, which is obviously the glutes are a huge part of this movement, but also any movement really, like walking, even standing upright. The glutes are very important muscles in terms of sparing back pain and also ambulation and standing upright. So if you want to look at those exercises, you can. But I would recommend if you are in pain, whether it's back, knees, hips, anything really, get it checked first. So this is often this is called a potty squat, or it's just a basic squat technique really. What I try and encourage people to do, and I do talk about hip hinge as an important part of movement in one of my other videos. Hip hinge is being able to move through the hips, keeping this stable in a relaxed way. It's very important in terms of being able to bend and squat, keeping your back neutral and predominantly getting the movement through your hips. So hip hinge is an important part of the squat in terms of being able to do it in a relaxed manner. But I often teach people to try and practice their squat movement. Quite often what I see is a lot of people, when they do come to squat, they tend to stay very straight in the back, and they go down with their knees going forwards, back very straight. I'm struggling to do it because I've practiced the squat movement so much, but they tend to go down very straight and puts a lot of pressure on the knees, and in the end they end up rounding off through the back to try and pick something up. Or they just simply haven't even got that level of hip motion, they tend to just go straight for back motion. What I try and encourage people to do is get shoulders back, stick bum out, try and go back into that squat movement, but you're trying to take the hips down and back at a 45-degree angle. And the reason I've got this stool here, and this might be a little bit low for a lot of people, is you're trying to actually take your hips down and back at a 45-degree angle until you touch, and then you power yourself back up in a controlled way by driving through those hips. Okay, so you want to squeeze those glutes as you come up. You want the drive to come from the glutes, not from the back, not from the hamstrings. You want the hip drive to come from the glutes. So down, touch, power yourself back up through the glutes. Okay, and I see a lot of people with issues in the glute muscles nowadays, primarily because we're quite inactive. And the glutes are probably one of the most important muscles in the body when it comes to movement. So really important to practice that motion, I think, if you want to remain pain-free. And if you're a biker like me, mountain biking, or even road biking, the glutes are essential for driving power, but so is that hip hinge motion. If you want to get down in the saddle into that attack position, whether it's on the road bike, mountain bike, you want to distribute your weight evenly, you need that hip hinge, you need that movement, and you need the drive through the legs when you're getting the power into the pedals. So in terms of biking, very important. All right, thanks for watching. I'll see you again.